Now, in addition to the individual races, State Question 802 played a key role in driving up voter turnout around the state. The expansion of Medicaid in Oklahoma did pass by a narrow margin. ONR's Rory Taylor has a reaction and more on what's next for those who supported the measure and those who opposed it.
In Oklahoma, we have some great news for you tonight. This is your victory. We just won Medicaid.
At roughly 10 o'clock Tuesday night, the vote on State Question 802 was declared to have passed, but only barely, by less than 1%. This map by the Tulsa World shows which counties favored 802.
We have been trying to do this through the legislature for some time. It's important to note that there have been 5 different legislatures and 2 different governors where this has been an option.
The newly minted law will increase Medicaid coverage up to 133% of the federal poverty level. For a family of 2, that means a combined annual income of less than $22,490.
200,000 Oklahomans are going to get access to health care that they don't have now. We're going to be able to bring back $1 billion of our taxpayer money and invest in our communities. That means more jobs and more local, state, and local revenue, tax revenue. So I think communities will be stronger, will certainly be a healthier state.
Opponents of the measure are less excited. State Republicans warned that the expansion could wreck the state's budget and lead to tax increases and service cuts. Jonathan Small, president of OCPA, said Tuesday night in a statement, "With oil prices still depressed and the response to COVID-19 continuing to wreak economic havoc, it's easy to anticipate next year another $1 billion budget shortfall for the state government, which Medicaid expansion will only worsen." But Yes on 802 says the state can't afford to not pass the expansion.
We've been allowing $1 billion of our own taxpayer money to go to other states to provide health care to people in New York and California. We can bring $1 billion of our taxpayer money home from Washington every single year to invest in our community. We know that that's going to create jobs and create local and state tax revenue that will then just be regenerated into the economy.
The Oklahoma Hospital Association is also glad for the Medicaid expansion as it will reduce financial strains and risks.
Oklahoma hospitals, year in and year out, provide over $500 million of unpaid care each year. And so clearly the uninsured is and has been an issue for all Oklahoma healthcare providers. Oklahoma ranks second in the highest number of uninsured, only behind Texas. Certainly, as more healthcare services are now paid for instead of provided on an uncompensated care basis, that means hospitals are going to be able to hire more employees. That means when hospitals hire more employees, then that means other healthcare providers will add more employees. When that occurs, those employees buy goods and services. They pay state, local, and income tax. And we know that this is an economic shot in the arm that Oklahoma quite simply needs right now.
Rory Taylor, The Oklahoma News Report.